Greetings and welcome back to the For Health Scholars channel. If this is your first time tuning in, my name is Dr. Orobosa, and on this channel, I show current and aspiring healthcare management, administration, and public health professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. Now, today's video is part two of a video series I'm calling How to Negotiate Your Salaries. Let's get to the money. And this video is dedicated to helping professionals who are working in the healthcare space how to negotiate their current job salary. All right. So, but before we get into the conversation, if you're new, there are two things that I need you to do for me. And that is the first one is to subscribe to this channel. And the second is to turn on your post notifications. Each week, I do post videos that really answer many of the questions that you have about the business side of the healthcare industry. I even answer questions that you probably can't find with a basic Google search. So definitely subscribe and definitely turn on your post notifications. You don't want to miss out, I promise. All right, so let's jump into the conversation, how to negotiate your current job salary. And here's a little tip of information from the field. And so a survey from salary.com revealed that only 37% of people always negotiate their salaries and 18% never do. It's even worse that 44% of respondents claim that they never even brought up the concept or the topic of, how to negotiate or raise their salary during their performance evaluation reviews. And this is alarming because if you're working for an organization, especially if you got into a place where you had your annual review, there should also be some talks about how to compensate you. And today I'm going to show you, if you're like, okay, I never even thought about that, but sounds like a good idea, then I'm definitely going to give you some tips on how to do exactly that, negotiate your current salary. And so here's a note that I stated in the other video, and I'm going to share it here again, that as a healthcare worker, please do not be afraid to negotiate your salary, even your current salary. Each and every time you go to work, you put yourself on the back burner and you really show up to serve others, especially as that's the name of the game in healthcare. So at least what your company can do for your time and skills and expertise is to pay you top dollar. So please be assured that how you're feeling is okay. It's just to want to have more money with the cost of living. I mean, let's talk about that for just a second. The cost of living has increased, and many people will say, okay, the economy is expecting us to pay all of this, but we have not had an increase in your salary. And that's just. But today I'm going to teach you how to see if you can get some more money for the current salary that you work, or to make a decision, or maybe it's time to go work somewhere else. Now, there are three stages of salary negotiation at this phase when you're negotiating your current salary. So phase one is the assessment component. Phase two is preparation, and phase three is the implementation. So phase one, when we talk about the assessment process, first things first, you need to trust your instincts and know that the time is right to even want to have your salary increase. The time is right. Bills are increasing, just the cost of living is increasing. And honestly, this is not a way that people should live. You should not live in a space where you're barely making ends meet and you're spending so much time, especially in healthcare. We know we spend so much of our time serving others that you should not be at a space where it's starting to feel really tight, or even that you can't afford to get up and go to work the next day because the income is not enough. So trust your instincts and know that the time is right. Also, in the assessment phase, you need to review your current and past performance evaluation. So look at the things that you did really well. Look at what your employer said that you did really well. Also look at your strengths. And even from the past evaluation, how did you turn that area which needed to be improved into your strength? Okay, because all of this is going to be helpful when you are submitting that email or that letter requesting for the evaluation of your current salary and for an increase. And then start to brainstorm in the assessment phase of the people and the ideal time you're going to need to or want to raise this concern of yours, which is definitely a pressing concern that you're being paid this amount and now you would like to get a higher income. Now, when it comes to knowing when is the right time, here's a few questions that you can ask yourself, or a few points to hold in your mind. You know the time is right when you're being paid less than the market rate for your position. And there's so many websites that you can go on that can tell you what is the average salary for medium and even entry level salary of your current job. So websites that come to my mind are like glassdoor.com, salary.com, and you can look by state. Even Indeed, Simply Hired, some of the other job search engines, they may have some positions that are similar to yours or the same position and have the salary range. And you can even find that for your own organization. They may be opening a position for a role similar to yours, or having someone new come in. And this information is really helpful because it's going to allow you to put a perfect pitch together. Then you know the time is right when the company is doing well. So the company is talking about their successes, the revenue is quite nice, your department or facility is meeting its targeted goals and exceeding its targeted goals. It may be time to have a conversation on how to increase your price. As what Fat Joe said, yesterday's price is not today's price. And that's something that I held on to since he said it. Okay. Yesterday's price is not today's price. And so if your company is doing well, they also need, if they have not initiated, to increase your salary, because some companies, they do that. When they're having a bonus, or the money is nice, they, as a way to sustain staff, they may give out bonuses or increase your salary. Also, if you went to school or you did a program or certification that helped improve your skills, you did a training, something that helped improve your skills. Now you have new knowledge, and that new knowledge you have been using to help the organization meet their goals. So it's time to talk about how to increase the price of your current salary. Also, you maybe have been offered another job opportunity, and now you're trying to see, because you really may have liked this organization that you're working for. You're probably not necessarily wanting to change your environment, but you are willing to if the price is not right, if the environment is not right. And so you may say, okay, let me ask if I can get a similar salary that they're offering me here at this job with this job, and have to leave and not go through the process of leaving a new job, meeting new people, etc. And so these are some of the lists when you know the time is right. It's not an end all be list, it's not exhaustive, but it's a starting point. And then after you have done that, it's time for phase two, the preparation phase. So you've conducted your research on current salary trends for your particular position. And now you're going to create your negotiation plan and write down your ideal salary and promotion wants. Because maybe you're not only just wanting an increase in salary, but you may say, I want to be promoted up to a position that they have available. And you need to create a nice pitch. Okay. And one of the ways to do that is to write out your thoughts initially, review them, edit them, so that when you're crafting this pitch, it's on point. They can't do anything less than say, okay, let's have a conversation about this and let's see how we can actually make this happen. And then in the preparation phase two, you're going to also ask questions and prepare your salary request letter or email. So you got to ask yourself some questions, and from those questions, prepare that email. Now, what are some of the things that you should include in your salary request letter? Well, of course, the purpose of that letter, then the reason you're requesting a salary increase, your qualifications to justify the rate change, which in this case is increase to your advantage. So this is where your current or past performance evaluations come into play, because you're going to pull out, your manager said you did this very well, you scored very high in these areas, and these areas have helped the organization achieve this goal, and this goal. You may have heard of the concept SMART objectives or SMART goals. Well, you also want to make sure that your salary request letter is also SMART. It's specific, it highlights measurable actions that you have taken. It discusses your achievements for the A, and then highlights the results and the time frame in which you did these things. Okay, so you want it to be smart. Okay, because you need to justify to them and show proof. Okay, this is why I'm asking for it. I have done this, and this. But in that letter, because you get more bees with honey than vinegar, you also want to talk about the things that you liked about the organization or the company, the things that they're doing well, and why you want to continue your employment with them. And this is having this increase in salary just makes it more advantageous for you to stay, because it costs an organization just as much money when they're losing staff as much as when they're hiring staff. So when there's a turnover rate in that organization, it's costing the organization money, and it costs them thousands and thousands of dollars. So most of the time, if you're a good employee, you're doing amazing work. They don't want you to leave because they know the time and the effort it takes to find a new person, and you don't even know. It's a risk. You don't even know if that person will perform as good as you. And then the dollar amount of the salary that you are wanting. And now this dollar amount is not your targeted dollar amount. It is a very high or higher than your targeted amount. Okay. And if you're not sure, watch my other video that talks about how to negotiate an offer job salary. Now, please make sure that in your letter, it also leaves rooms for negotiations to happen. Okay. You don't want it to be just an end closed off list or this is what it is. You don't want to give ultimatums, and you don't want to come off that you're being rude or demanding. Right? This is a conversation that you rightfully deserve to have, and you want this decision to be well thought out and that both parties are in agreement that, okay, we agree that it's time for you to increase your salary. I just did it. One of the facilities I'm teaching at, I just submitted a request and say, hey, after this, how many years I worked for your organization, this is my student success rate, this, et cetera, et cetera, et cetera. So I'm telling you what I have just recently done to make sure that I can enjoy living this life. Okay. And then moving into phase 3, which is implementation. So now this is where you're going to make your ask for the salary. And remember, the proposed salary is a higher than what your targeted salary is, because once again, if you get more dollars than what you ideally started, hey, that's a win-win for you. But also you want them to give them some room to negotiate if they see that it's best. Maybe you're currently making $80,000 and you want to make 85. That's like a sweet spot for you. Instead of just asking 85, because if they're going to negotiate, they may negotiate down and say, okay, we'll give you 82, but you really want 85. You negotiate higher. So you, in the proposed salary, you're going to put $90,000. And if they negotiate down, they may negotiate, okay, we can give you 88, but it's still $3,000 higher than what you was targeting. Okay, and that's just a little bit of the law of large numbers. If you ever want to why is it that the case? Law of large numbers, check that out. And then also you want to arrange the required meetings with the key decision makers. Who's going to make this happen? Or who do you need to speak to or meet with so that they can encourage the decision maker to sign off on your requisition for a salary increase? And then in the meeting that you're having with this person, speak about your accomplishments. People like to speak dollars and numerical numbers. As a former hiring manager, as a person who is working with organizations, have done some on contract work, just different avenues, I'm telling you, the people really appreciate when you come to the table with exact figures, especially when it's about you, the things that you have done. I helped the student retention rate increase from 67% to 97%. And that's really factual for me, for an organization that I was working for. And that one semester, wow. You think if I could do it for you, I appreciate it. And if you don't want to accept my rate increase, trust me, another organization would appreciate that I sustain the dollars that comes in through students who are attending their university. So you really have to have that confidence to know that what you're asking is nothing less than what you deserve. Okay, you're not an irrational person. I feel like for many people who work in healthcare, there's a part of you that's really compassionate, empathetic, and tries to be reasonable. And then you really share your accomplishments. Don't feel afraid to talk about the things you have done. Brag on yourself. It's all right, but brag in a way that is effective and is strategic. And so here is my golden rule. When you're asking for more money, then ask for more than what you want. And the range is usually about $5,000 to $10,000. You can do a little higher depending on the research you have done. If they're really underpaying you, and I've seen that happen where they're really underpaying you, especially as minorities. There's gender discrepancies in pay. There are minority discrepancies in pay. This is really especially for you. I'm a Black woman, and I've been able to negotiate my way to make things feel right for me, where I can enjoy the work that I do. And when it stopped serving me, I was not afraid to walk out of there or leave an organization. I think the shortest contract I ever worked or job I ever worked was about 4 months. And the environment wasn't right. They were not appreciating my skills, my time, my expertise. It was a very volatile environment. Things they were covering things under the book, and I had to make a decision that hey, there's no amount of pay worth my sanity, worth make me compromise my moral integrity, my ethical integrity. So you have to have the confidence to know that you deserve what you say is best for you. You know your worth, and it's okay to earn your top value. Just look at this is a story that came to my mind. In Dallas, there are two nurses who were just going about their day, and they had a patient, and the patient's significant other, I think baby father, was mentally ill. I'm going to put it that way. And he told her the next person who comes into this room, he's going to kill them. And she rang the call buzzer because she's afraid and scared. And the next two people who walked in the room were two nurses, and they lost their lives at work. So let me tell you, it's a risk, especially in healthcare. I've done so many trainings. I used to be a de-escalation trainer and teaching staff members about workplace safety and how to protect yourself in irate situations. It is a risk to work in healthcare. So don't be afraid to negotiate and to try to get what's rightfully right for you to be able to show up to work each and every day and enjoy the work you do, but also can live life outside of the job because work is only a certain amount of your time. And now, here are some things you should not do or ask. This is very important, okay? Because this is a strategy. You need to be strategic. This is not just, oh, I'm randomly going to ask for more money. No, it's the quickest way to fail when there's no plan, okay? So the first thing, don't discuss your personal life or things that is happening to you, right? Maybe you need this money because loved one is sick or you had an increase in bills. Keep your asks very objective. Make them merit-based, measurable accomplishment. Okay. Yes, when they increase that money, it's helpful to you. But I find that in my own experiences as well, and not knowing, sharing things that are happening in your personal life and how employees can use that to turn on you. I've seen that. I've experienced that where it's a point of time where I was not feeling well and it was really requiring me to get a lot of medical services. And the person who was my boss and just confiding and really turned against me and used my sickness against me. So it's not to say that you can't be personable or human in the workplace. No, absolutely not. But be careful on how much you disclose, because it's not the job's responsibility to feel sorry that you're going through this. It's a decision. Nobody's making you work for this organization. But it's nice when you work for an organization who cares about you. And one of the best ways that they can show that they care about you and value you is to increase your money. All right. And then don't be afraid to counter their offer. Don't be afraid. Like, remember, you did in phase one, you did your research. You planned this out. Okay. You knew that, okay, 90,000 is high, but they may come back and say 82. You're like, oh no, how about 85? Okay. Negotiate to your favor. And in this process, also avoid threats and ultimatums. You don't want to provide threats or ultimatums, and vice versa. You shouldn't work for an organization that is going to threaten you or provide you ultimatums. That is the time when you got to get up out of there. And then don't be afraid to ask questions. Many people, and I've seen this. This happens with my students. It happens when I was working in the field in management, that people are afraid to ask the right people who can give them the answers to questions. And I don't understand why. The worst thing that can happen to you is you get a no. That's the worst. And life still goes on after rejection. So keep that in mind, that don't be afraid to ask questions. And then after that, prepare yourself for the decision. And here are some potential responses. It can be they accept your offer and you now said 90,000 is more than what you asked for, but that's a great day. It's a great win. Or they may tell you it needs further review. So the person who's reviewing it, they may have to talk to somebody and they have to talk about budgets, finance, right? So that needs for review is not a no. So don't feel defeated. That is needs for review. They may just come back and say, okay, yeah, we talked to this person, we can give you that. Or this is what we're offering. But if they deny it, also keep that in mind. Take that in consideration that they've denied it. Maybe it's time to find something new. And so be confident in your ask and know that it's okay if you decide to walk away from a job that cannot no longer financially be sustainable or viable to you. Okay, your time, you can never get it back. And you shouldn't be struggling because you're working for an organization. So don't be afraid to walk away. I have walked away from jobs. I have walked away from offers and said, thank you very much. I didn't do it rudely. I didn't do it disrespectfully. I did it professionally. Thank you for this offer at this time. I'm unable to move forward because I'm not going to stress myself. There's this concept of living the soft life. And I really believe that some parts of it, if not all of it, many people should embrace. Well, in the healthcare field, it's not always easy to say, oh, I could work 4 hours a week. Ideally, I would like to work 4 hours a week and still get paid top dollars and live my life on an island somewhere. That may not be a realistic picture for now. But what could be a realistic picture for now is that, okay, for $90,000 in this management position, that because healthcare management administration, the type of positions you're working in, these are the business leaders of organizations. These are positions that without you, the organization is unable to generate revenue and account for its revenue. Okay, so keep these things in mind. Don't be afraid. Be confident in your ask and know that what's meant for you will happen for you. And maybe because you got this denial, it pushes you into the right opportunity. Because that's how I believe in my faith. And I hope that whatever your faith is, that is the same kind of confidence it gives you. My faith gives me the confidence to know that maybe this wasn't the right place. Maybe it's time for me to move on. And it pushes me into something better, greater. All right. So that is all that I have for now on how to negotiate your current salary. I really hope that these tips were helpful and my pep talk was helpful with you for someone who was just like, this is what I needed to get started. I'm wishing you all the best in negotiating higher pay for yourself. And so once again, thank you so much for watching. Like this video, subscribe and share. And until next time, bye for now.